Shoulder arthritis is when you lose the cartilage at the shoulder joint. All joints work. They've got two bones that come together at the joint. You've got a smooth layer of cartilage on both of those bones. Cartilage is supposed to rub on cartilage. When cartilage rubs on cartilage, there's no pain. There's no pain because there's no nerves in cartilage. Its main job is to really protect the underlying bone and the nerves that are in the bone underneath that cartilage layer. When you wear away the cartilage, you start to expose bone. Bone is highly innervated. If you break a bone, it hurts because there's nerves in the bone. When the nerves in the bone and the nerves in the bone are rubbing on one another, there's a lot of pain associated with that process, and that sends a message to your brain that you're having pain at that joint. And that's what shoulder arthritis is. Types of shoulder arthritis, typically the osteoarthritis is one of the most common types, but there are some people that have more of an inflammatory type of arthritis, such as rheumatoid arthritis. Some people have post-traumatic arthritis. Let's say that you're a wrestler, a football player, or a baseball player. You've dislocated your shoulder before. There's some trauma associated when you dislocate the joint, and that can slowly develop into an arthritic shoulder joint years down the road. Some people have had a fracture, either of the proximal humerus, their ball part, or the socket part, and that can predispose to post-traumatic arthritis. Some people are just very active, heavy bodybuilders that put hundreds of pounds and bench press heavy. Sometimes they're predisposed to arthritis at a younger age. Risk factors would be, your activity level. If you are a heavy bodybuilder, sometimes that predisposes to arthritis. I think that if you happen to have rheumatoid arthritis, that would be a risk factor. I think that unfortunately, obesity is a risk factor with the rising rates of arthritis at multiple joints. Obesity is kind of a double-edged sword. I think that you have a chemical environment in the body with that obesity that's somewhat destructive to cartilage. It weakens the cartilage, makes it more likely to then flake off the bone and lose the cartilage. And then oftentimes being heavy, it puts more stress across all of the joints. Thankfully, the shoulder joint is not as big of a weight-bearing joint like the hip or the knee, but still, when you have to push up out of a chair or do anything with added weight, it can put more stress across that joint and lead to accelerated loss of cartilage. Most common symptom is pain. You also start to lose range of motion. You start to have difficulty raising your arm all the way overhead, reaching behind you. You start to lose that range of motion. Sometimes you start to have mechanical symptoms, grinding, sensation in the shoulder can be a later stage of arthritis, and just pain primarily with activity. Sometimes the shoulder pain gets bad enough that even at rest, even when you're sitting or sleeping at night, you'll have significant pain in the shoulder that you can't rest. First part of the diagnosis is just taking the history from a patient. When they talk about their pain in their shoulder and how it started and what it's like, it leads us down the path. If it sounds like the typical shoulder arthritis problem, that would put that diagnosis into our heads. Typically, it's confirmed by X-ray. X-rays typically reveal that there's narrowing of the joint space, there's osteophytes or bone spurs that form, and occasionally we get MRIs, but we don't typically need an MRI to diagnose arthritis because the X-ray typically shows the classic signs of arthritis. Treatment for shoulder arthritis typically starts with the easy things first. Activity modifications. If you're working out heavy, lifting heavy weights, you want to probably back off of that type of activity. A little bit of physical therapy to work on range of motion and some strengthening exercises. And then we go into medications, Tylenol and some sort of an anti-inflammatory. Motrin, Advil, Aleve, or some of the prescription anti-inflammatories are also a good choice. Sometimes that can help alleviate the pain of arthritis significantly in the shoulder. The next order of business would be considering injections into the shoulder. That's something that we can do in the office. It's a pretty easy procedure. Most people tolerate that very, very well. We inject some cortisone into the shoulder. Cortisone is really the best anti-inflammatory we have, and it's injected higher dose right where you need it the most. A little bit better than taking oral anti-inflammatories, injecting steroids into the joint. That can give you pain relief for many, many months. Some people will get an injection about every 3 months. It's safe to do that. Finally, when you've exhausted conservative care and your level of pain, your level of dysfunction is great enough that you need more relief, typically we then go to shoulder replacement. And shoulder replacement is when basically we remove a little bit of the bone and we put metal and plastic bearing surface between those bones. The bones are happy again after successful shoulder replacement because they're covered up by the implant. And the bearing surface then becomes metal and plastic rubbing on one another. There's no nerves in metal and there's no nerves in plastic, so they can rub back and forth and you don't have any pain anymore.